Huh? She suffered from excruciating pains in the frontal sinuses, was prescribed Nosomika CM, headache gone, became a homeopath because she said that I couldn't help myself. Healing forces, she said, are available in nature. Not been by orthodox medicine or just ignored. So orthodox medicine just ignore this, that there is some healing force in nature. Then Roger Smith, MD. He is also another MD who never believed homeopathy. His father was cured. When he started believing homeopathy, his father was cured from chronic stubborn painful disease of digestive tract by Dr. Abbott, obscure homeopath from Switzerland. In 1918, there was a pandemic of Spanish flu. Mortality was rising by routine orthodox aspirin, etc. So aspirin was given, everything was given, the mortality was rising regarding the Spanish flu. Mixture, that time, mixture of influenzin, gelsemium, upator perf from Dr. A. Nibel, administered to 100 cases without a single casualty. This was a very important thing in the history of homeopathy. So there was not a single casualty when this mixture was given. Even here at Kolhapur, when we had swine flu, we dispensed, we made a combination considering the symptoms at that time, and the remedies, we came with a remedy, and then we dispensed remedies to the patients who were coming to my clinic, so at least for it, 50, 60 and 6,000, 7,000 people coming to my clinic, not a single patient had swine flu. Then Thomas Murray, MD, eye exam, and how he converted to homeopathy. So he came across a patient who was having eye problem, ophthalmic problem. The eye examination, when the eye examination done, it was strongly suggestive of blindness in both eyes. Both optic nerve heads were dead, white, and both deeply cupped. A picture, Dr. Murray says, had never seen in the eye with go fields. One eye had full normal vision and a full field of vision. It was, he said, quite beyond my comprehension. So even though such a pathology, advanced pathology in eye, still the vision was restored because of homeopathic medicine. And that is the common thing which I experience in my practice. I am having a case of cancer uterus, Sana OK from Gadinglas. The whole abdomen was involved with uterus and metastasis all over. At Gadinglas, just near by Kolhapur, when the patient was under my treatment, I never told her that she is suffering from cancer. But when she continuously starting to blame me, I asked her to go for a surgery. When she went and approached a surgeon at Gadinglas, she was opened and just immediately closed because the whole abdomen was packed with cancer. And this is the story some 1.5 years back. Still the patient is coming to me in a queue. That means in spite of pathology, advanced pathology, if the homeopathic medicine is there, the pathology remains at the same position, static, and the patient survives in a better way, enjoys good health in spite of the pathology. The another case is from Mumbai, Gone, who is a case of leukemia. In spite of, she is under my treatment since 1 year from Mumbai. In spite of such advanced pathology, all the reports are not normal, still the patient is normal physically, mentally, emotionally. The third patient was Bhagwan Patil's wife. She is also a case of leukemia. Since 1 year, 2 years I think, she is with me. The reports are not normal because the pathology advanced. Still the patient is physically, mentally, emotionally normal. That means there is something in homeopathy, even though the pathology advances, the patient remains, the immunity improves to such an extent that the reports though are against the patient physically, mentally, emotionally, they remain static, nothing. If you examine, if anybody is told about such patients, anybody is asked to look after these patients, they will say that they are healthy. So this is also my experience regarding homeopathy in advanced cases. Eugene Underhill, another MD, had difficult. He was suffering from arthritis knee. He saw a case of arthritis knee which began in the limbs, swollen skin, mottled skin, sitting with feet and legs in tub of ice water. So in the tub of ice water, the patient was sitting because the ice cold water was relieving the arthritis of that patient. Motion greatly aggravated. The very moment this patient is to move, there was great aggravation. And during day or night, where the aggravation during day or night, the aggravation was at night. Could not endure any covering over the feet or legs. This was the fourth thing. Ledum pal was given to the patient and the patient became normal within few days. Second case, this is the case which is observed by Murray, because of which he was converted to homeopathy. The second case was of a dysmenorrhea. The pains preceded the flow. She was a case of female case, a case of dysmenorrhea. The pains were preceded the flow. Flow slow, sluggish starting. Relief the second day. Second day it was to get relieved. Establishment of the flow. Pain spread all over the abdomen. The pains used to spread all over the abdomen. Worse, right ovary. Pains in spasm. They used to come in spasms. Cramp-like pains were there. Drove her to frantic. Relieved by bending double. So bending double she used to get relieved. Holding a hot water bottle in the lower abdomen. She used to hold hot water bottle lower the abdomen. This is the prime case of magnesia phos. Magnesia phos relieved her totally, relieved her problem of dysmenorrhea totally, and this Murray observed that the patient has become totally alright. Bryant is another MD converted by Walter James, pioneer of Indian homeopathy. Walter James. So now let us say something about the pioneers. Let us remember at least the pioneers of Indian homeopathy. The first amongst those was Rajendranath Datta. The period is 1818 to 1889. Pandit Ishwar Chandra Vidyasagar. Then Dr. Mahendralal Sarkar was the second MD from the Calcutta University. He was also not believing in homeopathy, but he became total convert to homeopathy. Mahendralal Sarkar was the physician who was attending Ramakrishna Paramahansa and looking after his throat cancer. Ramakrishna Paramahansa from Calcutta. So these are the people. Name others from Mumbai: Dr. Shankaran, Dr. S.R. Wadia, Dr. Sarabhai, who contributed a lot to homeopathy. Dr. K. We should not forget Dr. K.S. Srinivasan from Chennai. Dr. Ramram Patel from Kottayam, Kerala, who is a pioneer of tautopathy. Pioneer of tautopathy means he used allopathic drugs converted to homeopathy and suggested that allopathic drugs can be converted to homeopathic potencies and can be used for different ailments. So Ramnath Patel from Calcutta, we should not forget these pioneers in homeopathy from India. So homeopathy is a lifelong study. Homeopathy is a lifelong study. It requires a lifelong study. It requires the burning of much midnight oil, but it is worthwhile. These are the words of Dr. Shepherd, Dorothy Shepherd. A great responsibility rests on us, disciples of Hahnemann, to keep the flag flying and so to pass the knowledge on.